Your knees hurt when you squat. They ache after leg day. You've been told squatting is bad for your knees. You've considered giving up heavy leg training entirely. But here's the truth that changes everything. Strong knees are healthy knees. The problem isn't squatting. It's how you're preparing your knees. Knee pain is one of the most common complaints among lifters and athletes. But most knee pain isn't from structural damage. It's from muscular weaknesses and imbalances that place excessive stress on the knee joint. Fix the weaknesses, and the pain often resolves. In this video, I'm giving you the complete knee health protocol. The anatomy of the knee, the most common causes of knee pain in lifters, the exact strengthening and mobility exercises that create bulletproof knees, and how to squat pain-free for decades. First, anatomy. The knee is a hinge joint connecting your femur to your tibia. The patella, your kneecap, floats in front. 4 ligaments stabilize the joint. 2 menisci provide cushioning. Articular cartilage allows smooth movement. When any of these structures is stressed beyond capacity, pain results. The knee doesn't work in isolation. It's controlled by the muscles above and below it. The quads and hip flexors above, the calves below, and the glutes, which control femur rotation. Weakness or tightness in any of these muscles changes how force travels through the knee. The most common cause of knee pain in lifters is patellofemoral pain syndrome. Pain around or behind the kneecap. This is usually caused by the kneecap tracking improperly due to weak VMO, the inner quad muscle, tight lateral structures, or weak glutes that allow the femur to internally rotate. The fix for patellofemoral pain. Strengthen the VMO with terminal knee extensions. Loop a resistance band around a pole at knee height. Step into it with one leg. Extend your knee fully against the band. Hold for 2 seconds. 3 sets of 15 to 20 per leg. Strengthen the glute medius. When this muscle is weak, your femur internally rotates and your knee collapses inward during squats, banded lateral walks, clamshells, single leg balance work. Train these daily if you have knee pain. Quad and hamstring strength are the foundation of knee health. Strong quads absorb force that would otherwise go through the joint. Spanish squats are excellent. Anchor a band behind you at waist height. Loop it around your waist. Squat down, keeping your shins vertical. The band pulls you backward, forcing your quads to work. 3 sets of 15. Nordic hamstring curls strengthen the hamstrings through their full range. Weak hamstrings relative to quads is a major knee injury risk factor. 3 sets of 3 to 5 controlled negatives. Build up over time. Calf strength matters for knee health. The gastrocnemius crosses the knee joint. Strong calves help stabilize the knee. Single leg calf raises on a step with a 3-second eccentric. 3 sets of 15 to 20 per leg. Mobility work. Tight quads and hip flexors pull on the kneecap and alter patellar tracking. Foam, roll your quads. Stretch your hip flexors daily. Tight calves limit ankle dorsiflexion, which forces your knees to compensate. Stretch your calves daily. Squat form adjustments for knee health. Keep your knees tracking over your toes. Don't let them cave inward. Externally rotate your hips slightly. Think about screwing your feet into the floor. This engages your glutes and keeps your knees aligned. Don't bounce out of the bottom of a squat. The rapid change in direction places high stress on the patellar tendon. Control the descent. Brief pause at the bottom. Drive up smoothly. This is safer for your knees and more effective for muscle growth. If a specific exercise hurts your knees, modify it. If back squats hurt, try front squats. If both hurt, try box squats. If all squat variations hurt temporarily, do leg press, Bulgarian split squats, and hip thrusts while you rehabilitate. There's always an alternative. Knee sleeves provide warmth and proprioceptive feedback. They don't mechanically support the knee in a way that prevents injury, but the warmth and compression make your knees feel better during training. Use them if they help. Don't rely on them to fix underlying issues. When to see a professional? If knee pain is sharp and localized, if there's visible swelling, if you cannot bear weight, if the knee gives way or locks. These suggest structural damage that needs medical evaluation. Most gym-related knee pain is muscular and fixable. But know when to get help. Healthy knees aren't a gift. They're built. Through strengthening the muscles that support them. Through mobility work that maintains range of motion. Through intelligent training that respects your body's signals. Invest in your knees today, and they'll carry you through decades of training. Fuel your body right. Build bulletproof knees. Hit subscribe for training wisdom that keeps you strong and pain-free for life. See you in the next one.